I'm going to talk about know your risk and know your response towards diabetes. So basically, we're going to empower ourselves with the knowledge about diabetes so that we can prevent it. Okay, and I'm Dr. Roshini, a consultant diabetologist at Vinita Hospital, and understanding diabetes, we'll explore the risk factors and management strategies for diabetes. We'll also discuss about the importance of early detection and lifestyle modifications. So why are we talking about diabetes? Is because of the prevalence. So worldwide, 500 million people are affected with diabetes, and India is the second in the world after China. So that's something that alarms us, that we should all take actions towards management of diabetes. So as you could see in this picture, in India, an estimated 7.8% of the population above 18 years of age have raised blood glucose. So we need to target the school age group as well and college age group as well to prevent the obesity and thereby, prevent diabetes. And 2 out of every 5 women with diabetes are of reproductive age group, accounting for over 60 million women worldwide. So that's when the GDM comes. So we have to be careful about that as well. And if you could see in this picture, almost in 2021, so you could see how much people have been affected, and 1 in 12 Indian is living with diabetes worldwide, like in India. So next, knowing the basic differences, as you all know, type 1 diabetes is something where the body does not make enough insulin. So basically, type 1 diabetes, people are insulin dependent, and type 2 diabetes is where we cannot use the insulin properly. That's because of the insulin resistance. So age group, type 1 is most commonly seen in younger age group, and type 2 is usually seen above 40, but nowadays we don't stick to the age. Even at the age of 25, we detect type 2 because of our lifestyle. So that is one of the alarming things that we have to see. So this is the overlap between the type 1 and type 2. So basically in type 1, the causes are unknown. It's due to the genetic. And type 2, it's because of the inactivity, obesity, and genetic aging is also there, but in type 1, it is more common. And as you all know, type 1 requires insulin lifelong, and type 2 doesn't. So people also have that tendency that once we start insulin, it's lifelong. It's nothing like that in type 2. So symptoms, as you all know, there's a slow healing process, frequent urination, increased thirst, and people feel hungry, feeling very tired, blurry vision, and then they're more prone for infections, and tingling and numbness sensation in their hands and feet, and weight gain or weight loss without trying. So all these should be kept in mind. So risk factors can be divided into modifiable and non-modifiable. So non-modifiable are something like younger age at the diabetes onset, and then diabetes duration and family history. These things cannot be changed. So what can be changed is the modifiable risk factor. We have the obesity, the waist circumference, hyperglycemia, hypoglycemia, and glucose. That is the glucose variability. We have fluctuations in the glucose. That is one of the major things. Then hypertension should be controlled, microalbuminuria, dyslipidemia, smoking, alcohol. All these are modifiable risk factors. So as you could see in the image, physical inactivity, overweight, obese, and junk foods, and elevated blood pressure, smoking, and certain medication was also prone, like steroids will cause increase in sugar, and we have to keep a check during the steroid intake. So as I've already explained, race and ethnicity, family history, genetics, increasing age, and history of gestational diabetes, all this cannot be changed. These are the non-modifiable risk factors. So know your targets, that's more important. So what is the range? So as per the ADA guidelines, it is American Diabetic Association guidelines, your fasting level should be between 70 to 130 and postprandial less than 180, that's the maximum level, and HbA1c less than 7%. So universal target is HbA1c of less than 7% and fasting less than 120 and PP less than 180. As a single number, you can have it like this. Yeah. So what is glycemic pentad? So basically we have HbA1c, fasting, and postprandial. These three we consider usually as a target, but it is not only these three. There are two other wings, that is glycemic variability and the quality of life. So all these five constitutes a better and controlled diabetes we can have with all these five constituents. So basically, with quality of life, when you are stressed and when you are not having a proper lifestyle, your sugars will definitely be affected. You will not be under control. And again, glycemic variability is where too much of hyperglycemia and too much of hypoglycemia, again you will have an end organ damage. So that is one of the things that we have to have in mind. So this is the pathway, just to give an overview. When there is high glucose fluctuation, there is a stress in the mitochondrial level, and there is something called as superoxide production. So that is increased, thereby enhancing the polyol activity and advanced glycation of end product and metabolic pathway. Increased reactive oxygen species production is increased, and at the genetic level, angiogenesis is affected, and inflammatory pathway is increased, and oxidation of DNA and lipid membrane protein are increased, thereby affecting the cell. So basically all these pathways affects these cells. What are the cells that gets affected? In the eyes, retinal cells; in the kidney, nephrons; in the brain, neurons; beta cells, and the cardiac muscle cells. All these cells get affected, thereby leading to the complications of diabetes. So is diabetes preventable? What do you guys think? Is it preventable or not preventable?
Today's day, we think it is preventable.
So basically, type 1 is not preventable. Type 2 is preventable. So 50% is preventable with just maintaining a good healthy weight, healthy diet, and physical activity. By staying ourselves active, we can prevent diabetes. So the complications of diabetes, we have, as I've explained, what are the cells that gets affected. So we have in the heart, we have heart disease, like we can get coronary artery disease, myocardial infarction, and then stroke. All these are more common because of the damage to the cells. We have seen the pathway, how it affects. So we should, we can prevent heart attack, and we can prevent any stroke just by maintaining a diet and physical activity and the lifestyle modifications like sleep pattern and all. If we are having a good 8 hours of sleep, that will prevent diabetes. And diabetes and CKD, diabetes can affect the kidney cells as well, and it reduces the ability to filter the waste. So basically, this can lead to the CKD, which can cause the kidney failure if not treated. So right time diagnosis is more important. So one of the thing is that people don't check their sugar. They check the sugar level sometimes, but they don't do the RFT, renal function test, regularly. So, or they don't do the ECG or echo, which should be done early. They think we should not do master health checkup, and that's not going to help us. No, it's not like that. For diabetes, each and every organ gets affected. So we have to do regular checkup. At least once a year, we need to check the renal function, liver function, and diabetic foot test should be done, because sometimes people don't pick up the sensation of the foot. So sometimes they develop numbness in the feet, and those things are not picked up earlier. So with the proper screening, we can pick it up. So yearly once, if you're going to do all these tests, at the earliest stage, we can pick it up and prevent the further complications. So diabetes management involves better overall glucose levels, HbA1c, and then minimizing the hypoglycemia and limiting the glucose variability. We have seen the glycemic pentad already, so that is one of the ways. And what are the ABCs that we need to target for diabetes management? So one is the A1C level, the other is the blood pressure, and third is the cholesterol. So A1C is ranges about less than 7%, and blood pressure about 130-80 millimeters of mercury, and cholesterol basically LDL less than 100 we need to target. Apart from this, we have to stop smoking. That is also one of the important thing, where smoking cessation can also help us to prevent the cancer. Yeah. So excess weight means excess risk, and get your steps up and your risk down by a healthier lifestyle. If you just with the lifestyle modification, we can prevent type 2 diabetes. So people usually say with our job, like the timings, we are not able to do much and we don't get the time to do the physical activity and all those things. But that's not like we can do it just by, carrying some healthy snacks and then by walking and performing some chair stretches. All this helps. That's also a kind of physical activity. And in 24 hours, we can definitely spare half an hour, right? Does everyone agree with this? Half an hour of walking. We as doctors also don't do it. We do the rounds, but that's not the walking. We should do a continuous walking so that the insulin resistance will improve. So that we don't do it. So we should spend at least half an hour a day. 24 minutes, in our 24 hours, half an hour, half an hour we need to practice walking every day. So the 3 pillars of health is sleep, diet, and exercise. So exercise I've told you now, and sleep, at least minimum 8 hours of sleep is important, to prevent complications due to diabetes. And stress is also one of the major factors. So you can do yoga and de-stress yourself to control your blood pressure as well as, diabetes. And nutrition, when coming to diet, so basically we used to take, like the quantity is not, we don't concentrate on the quantity. So as of diabetes is concerned, we usually suggest 1,500 kilocalories of diabetic diet. So I don't want to generalize the diet like that. For each one, it will vary. So we have to individualize and get a proper diet chart and follow. Or a simple rule, what you could do is reduce your carbohydrate intake. So whatever you're consuming, for example, if you're taking 4 idlis, reduce it by half. So make it as 2 idlis. Taper it down slowly. If you reduce the carbohydrate and increase your fiber intake, that will help you. So protein intake, just look out for your comorbidities as well and then concentrate on the protein. But fiber, definitely, yes, you can increase. So have a proper diet which is low carb, low fat, increase your fibers and protein intake. Yeah. So lifestyle modification has the 6 pillars. This is what is warranted for us now. So one is healthful eating, physical activity, stress management, relationship and sleep, and tobacco cessation. So all these things which can be easily done can help us in preventing diabetes. Better not too high, not too low. This talks about the glycemic variability. So fasting and so anytime it should not go below 80. That is hypoglycemia. Most people don't know what is hypoglycemia. So anytime your blood sugar levels should not go below 80 milligram per deciliter. And if at all it goes, you should take some liquid diet which will raise the sugar and followed by some complex carbohydrate like bread or some biscuits. So then the sugar doesn't spikes up and then again it should not fall down. It should sustain. So you have to follow it up with a complex carbohydrate diet so that the hypoglycemia gets settled. And obviously if you're having hypoglycemia, please do consult your diabetologist. Make sure that it is under range and make sure that it doesn't have too much of glycemic variability. So quality of life does matters. So take care of your health and prevent diabetes with all the lifestyle modification. Thank you.